So, welcome and thank you very much for joining us on our Sunday afternoon tea with docs. I'm Dr. Linda, emergency and lifestyle medicine physician here from Sheffield. If you're new to our show, well, we are here every Sunday at 5 p.m. UK time, bringing you world-renowned expert, like our guest today, Dr. Balazs Bodai. Our job here is to bust medical misinformation and share practical, evidence-based lifestyle advice that you can implement right away to help you prevent, treat, and reverse chronic diseases in a supportive community setting. After the interview, if you joined us here on Zoom, you will be able to speak to us and our guest expert off camera to ask your burning questions and get to know our supportive ATWD community. Today, we are going to speak to Dr. Balazs Bodai about lifestyle medicine and breast cancer survivorship. And in particular, we will address diet, exercise, and the microbiome. A little bit about Dr. Bodai. He was born in Budapest, Hungary, 1951. He and his family lived in a bomb shelter for nearly a year before they managed to escape during the Hungarian Revolution in 1957. Following immigration to the United States, Dr. Bodai received his BA and his master's degree from the University of California, Los Angeles. He received his MD degree from the University of California, Davis in 1977, and Dr. Bodai served as Chief of Surgery at Kaiser Permanente, Sacramento for 15 years and directed the Breast Cancer Health Center from 1997 to 2011, which was recognized nationally as a center of excellence. He has authored over 250 medical articles and has published 5 books, 4 of which focuses on cancer, and he holds several medical device patents. After treating thousands of patients with breast cancer, he became frustrated at the pace of funding for research. In a remarkable one-man lobbying effort, he was able to convince Congress and the U.S. Postal Service to issue the breast cancer research stamp, the first ever stamp in the U.S. history that sells at more than face value, 60 cents, with the surplus amount donated directly to breast cancer research. Over 1 billion stamps have been sold, raising over 100 million for crucial breast cancer research. Bravo. Since retiring from the surgical treatment of breast cancer, Dr. Bodai has become certified in oncological rehabilitation. After performing thousands of breast cancer surgeries, Dr. Bodai transitioned from surgical care to the new field of survivorship care. In 2011, he co-founded the Breast Cancer Survivorship Institute. The goal of this center is to help patients who have finished their active treatment and are transitioning back to a normal life. His work at the Institute has led to a major interest in lifestyle medicine and his profound influence on not just recovery from breast cancer, but overall health. In April 2015, Dr. Bodai was nominated for the Congressional Gold Medal, and in 2018, Dr. Bodai received the Lifetime Achievement Award from the American Society of Breast Surgeons, and in March 2019, he received the Lifetime Achievement Award from the National Consortium of Breast Center. Thank you so much for joining us today, Dr. Bodai, and taking time out of your precious Sunday to talk about breast cancer and survivorship today.
Well, thank you for that lovely introduction. That sounded more like a eulogy than an introduction, but I appreciate it very much. And I appreciate the invitation that you provided for me to share some of the crucial information of lifestyle as it relates to breast cancer. And as you know, breast cancer is steadily on the rise. Worldwide. There's probably about 2.5 million plus women who are diagnosed with breast cancer, and probably about 650,000 deaths annually worldwide. In the United States, we have about 250,000 cases diagnosed with about 50,000 deaths. And in the UK, I believe you have about close to 60,000 women who are diagnosed with breast cancer as well. So it's a very, very prominent disease. And there's a number of reasons that we're seeing, quote, a rise in breast cancer. Number one, the population is aging, and most cancers increase with age. Number two, we are trying to do our very best to educate women about breast cancer and lifestyle issues. And also our screening has increased dramatically. So we're finding cancers at a much earlier stage, which is very good. It's also very controversial because some of the cancers that we find, I think we might be overtreating. It's a very indolent disease. And I think that, particularly in the 70 plus age group, I think there's some women that are being overtreated, particularly if they have a ductal carcinoma in situ or stage 0 breast cancer. So we are making progress in tapering back the treatments because they're very, very toxic. For instance, radiation dosages have been reduced now quite a bit. In a select group of patients, we've got much gentler therapies, but unfortunately chemotherapy, which remains a mainstay of treatment in addition to surgery, obviously is still extremely toxic. And one of the things we'll talk about perhaps a little later is how we can minimize the toxic effects of the treatments that we give the patients that we see. So the way I got interested in this is, for 35 plus years, I've been doing breast cancer surgery, and about 7-8 years ago, I made a very difficult personal decision to give it up because I had issues with my hands. I had Dupuytren's contractures from all the retractions and had a little bit of glaucoma. And so I was about 60 at the time, and I didn't want to retire. So I went back to school and I got certified, what's called oncological rehabilitation, as you mentioned, and set up the survivorship clinic, realizing that over the years, many women that we treated, they get used to seeing a doctor on a regular basis, their chemotherapy, their radiation, et cetera. And then when the acute treatment is done, the doctor goes, "Hey, you're done, see you later." And I just go, "What do you think I'm done? What do I do going forward? What I look for? What's my long-term plan?" So the real goal of it started out as a clinic focused on breast cancer, but then as it evolved over the years, it became apparent that lifestyle really was the major issue that we needed to address with these ladies as we try and return to their new normal.
And you mentioned sorry, there was a connection issue. You have mentioned that you noticed an overtreatment. Could you just clarify what did you mean by that exactly?
Yes, I can. So let's just take a typical example: a 70-year-old lady with ductal carcinoma in situ, stage 0 cancer that's maybe 6 to 8 millimeters in size. So we do surgery on them, which is fine. That should be removed. And then we do radiation, and then we put them on a hormonal blocker for 5 years, which has a number of horrible side effects. And it's really quite true that you can take a woman in that category and just treat them with surgery and radiation or surgery and hormonal blocker. We don't need to do all these things because DCIS and stage 1 breast cancers as well, invasive cancers, are really not in today's world a life-threatening condition. And the issue is that with these treatments that we're giving them, the radiation is cardiotoxic, particularly on the left side. No matter how good a radiation oncologist you are, some of that radiation scatters to the heart. And it's very interesting. Cardiovascular disease is the #1 killer of women in the United States and probably worldwide as well. Literally kills 6 times as many women every year as does breast cancer. And the reason for that partly is because women who are having a heart attack present a little bit differently than men. We males typically will get sudden onset of substernal chest pain running down there, up the neck, and so on. Ladies get that too, but often it presents in a much more subtle fashion with the following constellation symptoms: sudden onset of fatigue, like breakout in sweats, pain often relates to the jaw and to the back. And then many women who are having a heart attack also have abdominal pain, nausea, and vomiting. So they go to the emergency room. The emergency doctor looks at them and goes, "Hey, well, you must have the flu or COVID or gallstones." And the fact of the matter is, in the United States, at least, the emergency doctors are still in the mindset that heart disease is a disease of males because all the studies were done in men. Now, the consequences are not as aggressive at looking at women, particularly when they present with these rather atypical symptoms. And the chance of a lady dying of a heart attack are twice the size of men. And so tapering back on some of these treatments, because the hormonal blockers, for instance, raise your cholesterol, they cause blood pressure issues, osteoporosis, thromboembolism, et cetera. We can eliminate some of these risk factors that we're promoting with the overtreatment of cancers. And so my policy is, I'm not the oncologist, and the oncologists, when they see cancer, they want to, throw the kitchen sink at you. But I think really in a subset of patients, we're overtreating and we're making cardiovascular preps out of them instead of just letting the disease take its course, which is very indolent. If you get diagnosed with stage 1 breast cancer, it's a 95% survival rate these days. Stage 0 is a 99% survival rate. So this is where I think that we're overtreating some of the women.
In one of your most recent papers, you mentioned that breast cancer survivorship is on the rise, and it's nearly 90% of patients survive at least 5 years after diagnosis. And now breast cancer is no longer considered an acute disease. Rather, it is now a new chronic condition. What does it mean, and how does it affect how we treat breast cancer now that it's a chronic condition?
Well, that's a really good question. And the fact of the matter is that being a chronic condition, it now becomes the duty of the primary care physician to manage that chronic condition, just like they manage diabetes, which, by the way, is totally avoidable, obesity, et cetera. And so they are going to be charged with having to deal with long-term effects of hormonal blockade, osteoporosis, cardiovascular disease, thromboembolic events, et cetera. And so, because everybody is going to live for at least 75% of all cancers now survive 5 years, this offers us an opportunity to interfere or educate them about lifestyle issues and how they can reverse their diabetes, how they can reverse even cardiovascular disease that we induce with our therapies, chemotherapy, radiation, et cetera. And so we have a chance to, we call it a teachable moment, where the ladies have just been through a very bad experience. And one of the things that I dwell on with these ladies is, look, you just went through a really horrible thing. And if we change your lifestyle, we can decrease significantly your chance of developing a recurrence or a secondary primary malignancy. So that's really the focus of our institute when we see these ladies who finish the acute treatments.
And when we look, later we're going to look more in detail about lifestyle. But before that, if our listeners don't know what chronic diseases are and what is the metabolic syndrome, how would you describe it?
The metabolic syndrome is pretty much characterized by hyperlipidemia, central obesity, diabetes. And, unfortunately, obesity is a huge problem in the West. 33% of our patients are overweight, and 33% are obese. And so one of the primary focuses of our interventions is to try and get these ladies down to a near normal BMI. Now, it's not always possible, but every little step, every pound you lose decreases recurrence rates by a percentage point. So it's extremely important to address dietary changes, to avoid meat, dairy, and focus more on fruits, vegetables. Fiber is an extremely important component of a healthy diet, which, by the way, not only affects the gut microbiome, but also protects against colon cancer. If you eat a high fiber diet, you decrease colon cancers by significant percentage points. And the way I tell these ladies, if I were to go to Africa, on the entire continent of Africa, literally, you cannot find a single case of colon cancer because they eat such a high fiber diet. They eat like 50 to 80 grams of fiber a day. The average American one eats maybe 12 to 15, should be eating at least twice that amount. But it's very interesting too that you mentioned the gut microbiome. And for the audience, the gut microbiome is known as the second brain because it affects the entire body. And in a nutshell, the gut microbiome consists of 100 trillion plus bacteria, yeast, and fungi that live within our colon. 3 to 5 pounds of your body weight is actually bacteria. And people kind of they go, what? I go, well, you need these bacteria to survive. It's a synergistic relationship between they need us and we need them. They synthesize vitamins. They convert the foods into the energy that we need. But the bottom line is this: within the gut microbiome exists a subset of bacteria which is called the estrobolome. And the estrobolome are those bacteria which have the genetic capability to metabolize the estrogen in your body. And their favorite food is fiber. They love fiber, fruits, nuts, seeds, vegetables, legumes. So because 75% of cancer patients are estrogen receptor positive, their tumors are being fed by estrogen. It's extremely important to feed that estrobolome with high fiber, and that they will work overtime to protect your, to help you excrete the estrogen in your body and stop fueling the growth of tumor cells and perhaps decreasing recurrence rates. And by the way, and this brings up another very important point, and that is the hormonal blockade issue that we have with breast cancers. Typically, the recommendation is 5 years of an anti-estrogen therapy. This is subject to change now because there are several studies actually that came out of Europe about 3 or 4 years ago that showed that women who were on hormonal blockers for 10 years as opposed to 5 had a longer overall disease-free survival. There was a major flaw with both of these studies, and that is they did not segregate out ladies in the stage 1, stage 2, node negative, node positive. They put everybody in a big basket, and they saw a benefit, but they don't know in who. So currently there are several clinical trials that have stratified the ladies in the stage 1, stage 2, node negative, node positive, et cetera. So currently the ladies who are starting on their 5 years of treatment, we will know when they reach the 5-year mark, those studies will have matured, whether they would benefit from an additional 5 years. And I don't know what those studies are going to show, but I suspect that if you're node negative, which carries an excellent prognosis because node involvement is directly correlated with recurrence, then 5 years is probably going to be adequate. But this brings up another very important issue. Half of the ladies do not take the hormonal blockers for the full 5 years. And there's been multiple studies that have shown this. And the significant part is that they discontinue therapy because they don't see the benefit of it. They're having all these side effects, hot flashes, mood change, insomnia, et cetera. And so half of ladies do not finish the full 5 years. And the real significant part is so that most of the women who stop the hormonal therapy are young. They're in their 40s, and they're the ladies that would perhaps benefit the most from long-term therapy.
So if patients are worried about this question, as you have raised it now, is there a conversation that they can have with their physicians around this topic?
Can they what? I'm sorry?
If now our listeners might question, should they continue with their hormonal therapy longer than 5 years? Do you think there would be a good point for them to have a conversation with their oncologist around it?
Oh, absolutely. Absolutely. And the thing is that here's another kind of funny thing. Not funny, it's kind of sad, but you know that most women who stop their anti-estrogen therapy do not tell their oncologist that they stopped. And the reason that we found this out, there was a very large study at my institution about 7, 8 years ago that looked at 9,000 women. And when we found out how many were not taking their medications for the full 5 years, our pharmacy put a program in place where if you don't get your prescription filled every 3 months, the pharmacy will start calling you and hounding you to come in and take your medications. So that's been fairly effective, but still, many women don't take it. And, even when they come in for our initial visit, they tell me, I've decided I'm not taking that drug. So at that point, what I tell them is, look, if you're not going to do it, then I really want you to follow a very high fiber diet, plant-based diet, phytoestrogens. The oncologists in the United States and perhaps in UK as well when they see the word phytoestrogen, they get very nervous because of the word estrogen. And these cancers are being fueled by estrogen. And trying to convince them is that phytoestrogens are totally different than the endogenous estrogen that a woman manufactures in her whole body. In fact, the phytoestrogen, soy, is always the big question. Should I avoid soy? That's absolutely. There have been several large studies now that show that women who take high amounts of soy after breast cancer, even estrogen receptor positive, have a longer overall disease-free survival because the mechanism of action is thought to be that the phytoestrogens actually compete with the estrogen receptor sites on the breast tissue, which all the breast cells have. And if they occupy those sites, they then compete with the endogenous estrogen that one's body is making to occupy those sites, and it fights them so that they don't get the estrogen stimulation from their own bodies. So the women that tell me I'm not taking it, they've already made up their mind. They've done their research. Everybody's on Google these days. Google's your primary care physician these days, which is a very dangerous situation because there's so much misinformation on there. I just tell them, look, if you're not going to do it, I respect your decision. I understand, but you got to do this. You got to eat a high fiber diet, eat plant-based.
And when we talk about a high fiber diet, what kind of foods are we talking about?
So we're talking about fruits, vegetables, nuts, seeds, legumes, beans, etc. These are all high fiber diets. And I also suggest supplementation with flaxseed, ground up flaxseed. Add it to your oatmeal, put it in your salads. It's an excellent source of fiber. Again, it'll also decrease chance of colon cancer risk. So the ground up flaxseed is kind of one of these miracle drugs. No side effects, dirt cheap, has no flavor. In fact, adds a little crunch to your salads, which is not bad. But 3 tablespoons of ground up flaxseed is equal to about 1,000 milligrams of the pill, which I don't like the pill. People will take the pill because it's convenient, but there's no fiber in the pill. So you really got to get your flaxseed from the ground up flaxseed meal.
And what does physical activity have in this equation? How does it affect breast cancer survivorship?
Oh, that's an excellent question. And in a number of ways. Physical activity, number one, will decrease stress. Stress obviously is a major risk factor for not just breast, but all cancers. You would not believe, you probably wouldn't because you see this, but most of the women that we see have had some major stressor, whether it's loss of a spouse, loss of a job, loss of a child, moving, changing jobs. They all, within the last 2 years before their diagnosis, have gone through a major stressful event. So physical activity decreases stress, helps with weight control, decreases hopefully weight if you exercise. And it's minimal. All you have to do is walk 30 minutes a day, 5 times a week is what we recommend as a basis. It decreases inflammation because as you exercise and decrease your body fat, you decrease the inflammatory proteins and the estrogen in postmenopausal women, which is stored in the fatty tissues, particularly the central fat, which is what we kind of all struggle with. So it's good for stress reduction, weight control. It's anti-inflammatory. In fact, physical activity will decrease, and this is shown in many, many studies, decreases recurrence by 20%, decreases development of new cancer, or decreases mortality from breast cancer by 30%, and decreases overall mortality by 40% because of the wonderful effects it has on the cardiovascular system. So physical activity is really important, but I do want to emphasize one thing. You cannot exercise your way out of a bad diet. Okay, so they go together. You can't just be physically active and eat garbage all day long, your potato chips. I tell people, I ask people, what do you think is the worst invention of the last century? And I think it was the remote control, because you don't have to get up off the couch to change your channels, and you sit on the couch and eat your potato chips and ice cream. And now you have this computer, Alexa, you can talk to, it's on Mozart, dims your lights, and et cetera. So our inactivity, the sedentary lifestyle of the 2020s is the equivalent of smoking of the 1960s, where we knew that smoking causes lung cancer. Now we know that being inactive, being a very sedentary society, increases inflammation, obesity. It's responsible for the epidemics of obesity, type 2 diabetes, hypercholesterolemia, cardiovascular disease, cancer. So activity is an extremely important component, but it does need to be coupled with a healthy diet.
And we talk about obesity quite a bit with metabolic syndrome and chronic diseases, but just to highlight that also people who are not obese, they can have, and actually here in the UK, it's 1 out of 4 who does suffer from metabolic disease and isn't obese and actually is slim. But when we are talking about obesity, what is it about the adipose tissue, the fat tissue, and breast cancer? How is it linked exactly?
So, we have to look at, the fatty tissue is actually, the fat or adipose tissue is actually an organ. Okay. We don't look at it as an organ, but It is. It's metabolically active, and it produces and stores inflammatory proteins, and it produces estrogen too. It's a major source of estrogen, particularly in postmenopausal women whose ovarian function is pretty much defunct. Their main source of estrogen is not just the adrenal glands, which metabolize cortisol and cortisone and spit off an estrogenic molecule, but also the fatty tissues, which store and produce these inflammatory proteins. So we have to look at the fatty tissue as an individual. It's an organ. It's not just fat. It's actually a metabolically active organ.
So that is the key there, that it's a metabolically active organ, which is constantly releasing estrogen into the bloodstream, and thus there's a clear link that we have to address. And I think very rarely do we highlight that to our patients, why obesity is such a big problem. When we look at the dietary intake from the two perspectives, from a standard Western and American diet, which is low in fiber, and the whole food plant-based diet, you showed in your last research in how it actually results in the increase and the decrease of breast cancer. Is it mainly that it acts on inflammation? And if it is, from the microbiome point of view, how does it affect on it?
Well, as I mentioned, the fatty tissue is an active organ, and it is producing these inflammatory proteins and estrogen. It's major storage in postmenopausal women for both the inflammatory proteins and the estrogen. And so in relationship to the microbiome, it gets a little bit complicated, and I don't want to get too much into it, but if you eat the standard American diet, you're going to reach this enzyme called beta-glucuronidase. Beta-glucuronidase is responsible for deconjugating. Oh, you got the slide? Okay.
I just thought I'll show you. I think it was really, really useful.
Yeah, so that what you can see that there's an increase in the beta-glucuronidase, which then deconjugates estrogen and puts it back into the circulatory system. And so you can see if you're eating the standard American diet, you're increasing your beta-glucuronidase. There's another very interesting issue that occurs here, as you'll notice in the slide, that you will, because of the bad bacteria that you're feeding, the Bacteroides, the bad set of bacteria, you decrease your production of short-chain fatty acids, the butyrate, propionate, acetate, which leads to what's called the leaky gut syndrome. And the leaky gut syndrome, probably half the world's population has it. And what happens here is that within the colon is what's called the columnar layer, and they have tight junctions. And when you eat bad foods, those junctions are disrupted, not just with foods, but with toxins, antibiotics, allergens, etc. And as those cells separate, what you have is you get all these toxins leaking into the circulatory system, causing inflammation. So this is where, again, the gut microbiome is so important, because we want to decrease the amount of toxins leaking into our body, the so-called leaky gut syndrome. And you can see on the other side of the slide with a plant-based diet, you've got exactly the opposite thing happening. You increase butyrate, acetate, etc., decrease beta-glucuronidase activity, so you're not recirculating the estrogen in your body. So this slide is actually a very important one, because it kind of summarizes exactly what the two issues are between plant-based and animal-based diet: short-chain fatty acids and fiber and beta-glucuronidase. These are very, very important issues. And it's all fiber related, as you can see.
Thank you for explaining that slide. Reading your paper, I thought it really summarized it so well, the bridge between breast cancer and our lifestyle and everything in between, chronic diseases, inflammation, and how that is relating to our daily activities and what we eat. So I will add this paper and all the other suggested ones into the comments on YouTube. So if anybody would like to read about it a bit more. And so now we have two perspectives, two aspects: the microbiome, exercise, and diet that we have covered. Is there anything else in lifestyle that you suggest to your patients every day?
Well, I'll tell you, stress reduction, extremely important. It's easier said than done, but stress, increases your cortisol, increases your blood pressure, et cetera. Acute stress is normal, the fear, fight and fight response. But when the stress becomes chronic, like I mentioned, these poor ladies that have all these chronic issues, they might be a caregiver. This is another issue that's becoming very important. They're caregivers for their husbands who've had a stroke or whatnot. It's constant stress. So we try to manage, try to give them, some stress reduction techniques. And actually, one of the interesting things that we found just recently is that yoga is probably one of the most effective ways to reduce stress. There's meditation, there's aromatherapy, there's all these other therapies, there's cognitive behavioral therapy, but stress reduction is extremely important, very difficult to do. Sleep hygiene is another important issue. I, speaking for myself, get very little sleep. And, I've been trying to work on my sleep hygiene, getting into a regular habit, not having a TV on, not using a computer before I go to bed, et cetera, getting into a routine. But it's very, very difficult. Stress is a very, very difficult thing to mention, or sleep hygiene is very difficult. And it's also related to stress. Our minds are racing all day long. Today or last night I didn't sleep much, because I was excited about meeting with you and your audience today. So I was pretty much wired all night, thinking about what we're going to talk about and being excited about this interview. So stress is very important. Sleep hygiene is very important. And also, just having a support system is so incredibly important. And, here's another very sad fact. Many of the women we see are either divorced or widowed, and they don't have a support system. And there's been several papers that have been published over the years that have demonstrated that those women who have a good support system, family, friends, coworkers, they do much better. They live longer. They don't have to deal with cancer as much. They're healthier. They're happier. So, having a social support system is extremely important. And, unfortunately, many women don't have that. But I will tell you something, not to brag about it, but when we see these ladies, I see them with a colleague of mine who's a female who is certified in lifestyle medicine as well. And it's kind of a dog and pony show. So I'll go in and then she'll go in and I go back in. And so many of these ladies look at us as a new friendship that they formed. And they see that we're here to support them. And even those who are lacking the outside support feel so well after it's an hour and a half long visit. It's a very intense visit. But they feel like somebody cares about them. Because their primary care doctors are afraid to deal with the cancer. Their oncologists are done with them. The radiation people are done with them. So they feel abandoned. They feel that the security blanket of being under the microscope during acute treatment is taken away. So when we see them, they feel like they developed a new friendship. And they always tell them, you can call me anytime. You can email me if you have any questions. So it's very important to have a social support system.
Yeah, social support, and also, I suppose, purpose, to refine purpose within that commotion, that when we recognize the difficulty that we are facing with cancer or other diseases, I think a lot of times our patients start focusing on that particularly and completely forget everything around it. Did you notice that your patients feel better when they refine their purpose as well?
Exactly. And, one of the things that I try and do is provide positivity for them. And I go, look, you have gone through a very bad experience. I'm trying to give you some tools to make sure you don't go through that experience again, because it's very scary. As you know, when someone's diagnosed with breast cancer, they kind of go into this coma. They kind of go, what? Why me? That's the number of things. Why did I get cancer? Even the ladies that are not overweight, they exercise, they eat rather healthy. Well, that subgroup may have a genetic component, even though we only know 5 or 10% of cancers are caused by genetics. But there's so much in genetics that we don't understand yet. We know the BRCA1 and 2, and then we look at like 36 genes now, and we wind up with these things called a variable of unknown significance. which means there's an abnormality, but we don't know what it means. There's a few that we do, increased pancreatic cancer, colon cancers, a few syndromes, et cetera. But the vast majority of women who diagnose, they kind of go into this coma. And my job and my colleague's job is to bring them out of that and say, look, you're done. It's gone. There's no evidence of disease. It's time to get back to your new normal. And that's something we stress with them very much, that, yes, it was bad. We treated it very aggressively. There's no evidence of disease, and it's time to move on. And here are a number of tools that we've shared with you that will help you return to a new normal.
So you just said only 5 to 10% of the cancers are actually due to genetic causes. And very often our patients say, well, somebody in our family has had cancer, so it's almost inevitable, I will have it as well. But this is not the case, is it? Absolutely
not. In fact, many women think that if they don't have a family history of cancer, they're safe. And that's absolutely not true, because 75% of women diagnosed with breast cancer have no family history. And the other thing is that, we really don't know, because, I don't know if your grandmother might have had breast cancer and she was never screened. They weren't doing mammograms back in the 40s, so grandma might have had it and we don't know. So having a negative family history is great, but it's not protection. What I tell the ladies too is that, in my opinion, cancer detection is a failure of prevention. And if you think about that, it's really true. Even my organization, Kaiser, I've been with them for 40 plus years, and it's been a wonderful organization, but they claim to be a preventative health maintenance organization. Well, actually, that's not true. They're reactive. They react. So you go to your primary care doctor, your blood pressure's high, here's a pill. Your sugar's high, here's a pill. Your cholesterol high, here's a pill. There's a pill for every ill. So that's being reactive. You're treating a condition that is developed. It's not being preventative. You can prevent all these diseases, the majority of diseases, by educating people about a healthy lifestyle. And that's where lifestyle medicine is becoming so important, because we can actually prevent the majority of diseases. It's really sad to know that in the United States, we spend more money per capita on healthcare than any nation in the world, and we're the sickest. And it's about our lifestyle. And I tell the ladies, if I were to go to like the Far East, like Thailand, for instance, and set up shop as a cancer surgeon or a vascular surgeon, I'd go out of business. The diseases simply do not exist there. Yeah, there's a number of migratory studies that show that when these people move here to the West and adopt our lifestyle, within 15, 20 years, they start getting cardiovascular disease. They start getting cancer at the same rate that we do.
There's such an urgency about this, because we know from epidemiological studies and from our clinical practice that our patients are suffering and dying early from diseases that could be prevented and in many cases put into remission, like as you mentioned, type 2 diabetes and cardiovascular disease. And here we are still practicing medicine in a very similar way as we did 100 or 200 years ago, where we are trying to be very reactionary and not preventing. So is it true then that breast cancer is on the rise? We are seeing that, right? It's definitely on the rise.
I believe so, because we're doing more screening, and women are more educated, they're more proactive about it, and the population is aging. And, age is a major risk factor for the development of malignancy, even though, particularly in a toxic world, because we're exposed to all these toxins, it's interesting that, the average female, if you get up and shower and use some shampoo, conditioner, a little foundation, a little lipstick, a little mascara, you put about 500 chemicals on your body every single day with deodorant, cologne, etc. Then there's all the food additives, thousands and thousands of food additives that are put in as the manufacturers process the foods. They strip the nutritional value of the food. They add hundreds and hundreds of chemicals to decrease cost of production, increase shelf life, make the food tastier. Well, that's fine, except that none of these chemicals are ever meant to be consumed by the human body. And when we ingest these products, our gastrointestinal system, which we know is responsible for a significant portion of our immunity, sees these chemicals and identifies them as a foreign body. And it goes, you guys aren't supposed to be here. And it reacts to them through the formation of dozens and dozens of inflammatory proteins, insulin growth factor, tumor necrosis factor, C-reactive protein, dozens of them and many more that we don't know. And it tells them you guys aren't supposed to be here, and it reacts them to the formation of these inflammatory proteins, which are then responsible for the two killer diseases, which are cancer and cardiovascular disease. These chemicals wind up in our colon waiting for our bodies to eliminate them. They cause inflammation of the colon, which is then the beginning of cancer. I forgot to mention, that breast cancer is actually an inflammatory condition. And this has been known for 150 years. Back in the 1860s, a physician named Rudolf Virchow, German physician, first identified the association of chronic inflammation and breast cancer. So we've known this for a very, very long time. So the whole idea here is to get the inflammation down in the patient's body, decrease inflammation. How do you do that? You eliminate the toxins. What's the number one source of toxins? All the highly processed foods that we eat. So this is another thing that we emphasize with them, significantly.
So if we know that it's an inflammatory disease, and you mentioned lifestyle changes, let's just recap for our audience, because to us, it's something we read on a regular basis. But when they think about a whole food plant-based diet, we are eliminating meat products, fish, and dairy. There's often the worry about protein, and also feeding their children on this diet because of elimination of protein. There's always this nervousness around it. What would you say to them about it?
That comes up all the time. Where am I going to get my protein? First of all, I want to say that in the United States, we consume way too much protein. We eat too much protein, which is actually toxic to the kidneys. And you don't need meat and dairy to get protein. You can get plenty of proteins from a plant-based diet, especially beans, much higher source of protein, lentils, high source of protein. You can get more than enough protein from a plant-based diet if you're consuming grains, fruits, vegetables, beans. Lentils are excellent source of protein. So you don't need the meat and dairy. In fact, the meat and dairy, besides having no fiber, they have meat has carnitine, dairy has choline. These two chemicals, when we ingest them, our liver turns them into trimethylamine. Trimethylamine, when it gets oxidized and combines with the low density cholesterol, the bad cholesterol, it sort of becomes a burrowing machine. And what it does is in the coronary arteries, which again is atherosclerosis, an inflammatory condition, the trimethylamine oxide and the LDL combined become a burrowing machine and will start eating into this thin endothelial layer of the coronary arteries. Okay, so then once they burrow in there, the body reacts to them through the formation of white cells, which go there to try and remove this. These become what are called foam cells, macrophages. And as they accumulate underneath that endothelial layer, when they raise that layer and the layer bursts, that's a heart attack. And by the way, I just want to mention, I have made a YouTube video on all this stuff on lifestyle and cancer. And it's really easy to find. Just you go to YouTube, just put in Bodai videos. And it's a 1-hour video I made on lifestyle and cancer.
I will definitely
Right.
add that.
Please add that.
Yes, I will link that into this YouTube video so that they can find it. So then if moms, because we are all about prevention here on Afternoon Tea with Docs, and as you mentioned, a lot of patients are getting diagnosed more and more, maybe because we are picking them up on them more, but also because of our Western diet and lifestyle, stressful lives. So if any mom or dad is listening and they would like to prevent their child developing breast cancer, are they safe to start their child on a whole food plant-based diet without worrying about it?
Absolutely. And you bring up a really interesting point, and that is that the meat and dairy products are fed hormones, they're full of antibiotics because of the horrible states that these animals are raised in. So what happens is that milk, particularly dairy or cow milk, not silk and almond and the alternatives, they're full of estrogen. Here's something really rather disgusting, but I want to share with the audience, is that the Dairy Association nowadays is artificially inseminating cows year round to make them pregnant and make them produce more milk. Well, when the milk is produced and the cow is pregnant, guess what? Their estrogen levels go up. Estrogen goes into the milk, goes into the child. That's why we're seeing earlier development of menarche in women. You know, girls in the United States are actually starting to have menstrual cycles at age 9, 10. It used to be 12, 13. And we know that one of the big risk factors for menstrual cycles at age, we know that one of the risk factors for breast cancer is early onset of menses, because the earlier you start your periods and the later you go through menopause, you get 40, 50 years of the cyclic variation. That's why it's thought that pregnancy before the age of 30 is somewhat protective against developing breast cancer. Now we know ladies are becoming much more professionally active and they're putting off childbearing. That's a huge risk factor for breast cancer. So the young girls are getting all these hormones, and then cheese, by the way, which is concentrated milk, has 8 times the amount of estrogen as milk. So if you're giving your child, your daughter's cheese and milk, you're stimulating the estrogen in their bodies, and they're going to start early periods. Risk factor for development of breast cancer in later life.
It just breaks my heart to know that milk is actually obligatory drink in most of American schools and also here in the UK, knowing the clear link between cancer, prostate cancer, we have a clear link with that, and breast cancer. So it's not only men or not only women, but also men are affected by it. How can we get our patients to feel more comfortable with this decision? Are there any resources that they could follow up on after this talk with regards to changing their diet that you are suggesting more often?
Well, you know, unfortunately, this is the problem. There's a lack of resources, you know, and there's a lack of physicians like yourself who are dedicated to lifestyle. You know, there's a group, there's a group here in the United States, there's a group in the UK and Australia, et cetera. The problem is there's not enough of us. And, you know, everybody wants a quick fix. Okay, patients want a quick fix. You know, if you have high blood pressure, instead of losing weight and exercising and eating a regular diet, you're going to get a pill. And so everybody wants an easy fix, and it's a mindset. You know, it's very interesting. Some of my primary care colleagues, a patient will come into them, and if they don't leave with a prescription, the patient feels like they haven't been treated, and they get angry. You know, it's really crazy. And the worst example, probably, well, there's several of them, but with the overuse of antibiotics, you know, if somebody comes in with a sniffle, they leave with an antibiotic. Guess what that antibiotic's going to do? It's going to wipe out your gut microbiome within a few days, a few doses. So I really discourage use of antibiotics unless you absolutely need them. You know, if you have a severe urinary tract infection, severe sinusitis, then you got to take it. But, you know, most colds are viral and the antibiotics aren't going to do any good. So we are overexposing our population to antibiotics, which is then causing dysbiosis in the microbiome because it wipes out the healthy bacteria. The other thing we're overprescribing are medicines for esophageal reflux. You know, 15% of the patients are on these proton pump inhibitors. So guess what they do? They also interfere with the microbiome, and they also cause osteoporosis. They leach the calcium from your bone, and people are, you know, there's millions of prescriptions every year written for proton pump inhibitors, when GERD can actually be also controlled with a little bit of weight loss and a healthy diet. You know, you can get off these Nexium and Pepcid and all these other medications that we're handing out like candy. And, you know, the other thing is that the antibiotics too are in our foods, you know, particularly meat and dairy. And so the meat and dairy products, you're actually causing what's called dysbiosis, imbalance in the good and bad bacteria in our gut. Then you're going to start getting leaky gut syndrome, and it's kind of a vicious cycle.
And we have used antibiotics in the past to actually rear animals to fatten them up. We have seen a clear link between antibiotic usage and obesity for animals. So the links are really scary when we look at it close up. And our patients often, as you said, they come in with epigastric pain, reflux, discomfort. And the first thing we do in general practice and in emergency care is prescribe them omeprazole, lansoprazole, the proton pump inhibitors, without ever asking, how was your diet? What are you eating? And most often, this pain is actually caused by a low fiber diet and a high acidic food intake, processed foods, trans fats, which are really acidic and do not offer the fiber that we require. Very often now with my patients, even in emergency care, I sit them down, and before we go anywhere, we talk about their diet and suggest to them to increase their fiber intake. Because if we don't take on that mission at every level of care, then unfortunately a lot of patients will miss this message, because as you said, there's just very few of us who are trying to get this message across.
It's very interesting too. You broke quite a bit there, but milk is acidic, and so they tell you that milk is good for your bones, right? Well, guess what? When you drink milk, the body tries to neutralize the acidity, and guess what? They're leaching calcium from your bones to neutralize the acid and weakening your bones. So one of the biggest misnomers is that milk is good for bone because it's got vitamin D in it. Okay, well, you can get vitamin D from leafy greens, from beans, from lentils, fortified cereals. Mushrooms are an excellent source of vitamin D, so you can get plenty of vitamin. You don't need milk for vitamin D. You can get it from a plant-based diet.
And very often, actually, patients are drinking milk to kind of satiate the gastric reflux symptoms, which again, oh gosh, there's so much that we could do better, which is good because it's kind of hopeful that we have a solution. We just have to get it out there to our patients. So whilst it's kind of disturbing to know how many things could improve, it's also a quite hopeful message that we can do better, and with very economical measures as well.
Exactly. There's another huge problem, at least here in the United States, is that the Meat and Dairy Association are extremely powerful lobbyists. Yeah. They contribute a lot to the political parties. And as such, the politicians who should be paying attention to this, because it's costing us billions of dollars to take care of all these chronic conditions, they're afraid to face the Meat and Dairy Association lobbyists, because that's where they get a significant amount of their money. So one of the things that we really need to do, and I have tried to do this with a couple of congressional people that I know through my stamp work, is to convince them about this, but they will not take on the Meat and Dairy Association because, the minute they get in the office, first thing they do is start raising money for the next election, And so the government is really responsible in the United States, at least significantly, for not regulating the Meat and Dairy Association. One of the classic examples, high fructose corn syrup. High fructose corn syrup, very, very unhealthy. In fact, when people shop, if you see high fructose corn syrup in the top 3 ingredients, put that product back on the shelf because it's extremely unhealthy for you. And the history of it is actually political. Back in the 1960s, when Nixon was in the 60s, when Nixon was in charge, one of the big issues was the price of sugar and the price of food. So Archer McDaniel Argyle came up with high fructose corn syrup. Fructose is extremely bad for you. It's not 50-50, it's 55-45 fructose glucose. And it's very toxic to the liver. And it's in almost everything. So high fructose corn syrup is something you should definitely avoid. But we need to put some pressure on the politicians and say, hey, look, this is costing us a fortune, and it's costing lives and it's shortening our lifespan. I talk to the patients about, it's not about lifespan, it's about health span. you want to live a healthy life. Lifespan is great, but if you don't have health span, if you're wheelchair bound, you've got a nasogastric tube because you can't eat, that's not health to me personally. I like quality of life is super important, and so the government needs to become a little bit more proactive, but that's going to be a real challenge.
It is. And as we say in Hungary, there's a saying, isn't it? Money talks, dog barks.
Yeah, exactly.
Kutya beszél, pénz beszél, kutya ugat. I just
Yes.
our Hungarian little link. I had to bring it up. It is very, very saddening, but also it is something that we must take on and cannot shy away, and we cannot wait for the government to take leadership in this, because they have too much money in the game. And of course, as healthcare professionals, we do still have a standing in the community, where if more of us take on this message and also take on the lifestyle, which is very hard in our kind of clinical practice where we don't sleep much, we can still optimize what we eat and how much we exercise. And as you mentioned, we only need to exercise at least around 30 minutes a day to get that health promoting aspect of activities, eating a whole food plant-based diet from a young age, so that we do not accumulate through the years the chronic diseases. A good sleep around 8 to 9 hours, 7 to 8, 9 hours if you can, is very health promoting. And stress management you mentioned as well. These are really good points, and it's just incredible how powerful they are. Besides these, are there 3 actionable takeaway points for our listeners that you would share with us that they can use right away in their daily practice?
Yeah, so one of the things I do want to mention very quickly is I'm kind of glad to see that the food industry is starting to respond a little bit, coming out with silk milk, almond milk, non-dairy alternatives. There's yogurts that are non-dairy based. There's ice cream that's not dairy based. So the food industry is starting to recognize that the American population, at least, is becoming a little bit more aware of some of the unhealthy habits that we have. I do want to caution the audience about these plant-based, some of these plant-based food products that are coming out, like all the meat substitutes, Impossible Meat, all these other ones that are coming out, because they're also highly processed. So you got to be careful. And they also have a lot of sodium. And so it's good to eat sort of a artificial meat every once in a while, but it should not be consumed on a daily basis as well, because it's highly processed, a lot of sodium in it. In terms of what we can do immediately is, and I tell the ladies, I don't expect you to go home and clean out your refrigerator and get rid of all the bad stuff in there.
But it would be good.
It would be good.
It would be good, and it would be very health promoting.
Yeah, I actually do tell them, go clean out your refrigerator, but most of them won't do it. But a lot of them say, I'm going to go shopping. Okay, so that's great. And I show them a bunch of food products that are out there. So we can't expect somebody who's, way overweight to become a marathon runner in a week, so you got to move into it slowly. And I tell ladies, don't set goals that are unrealistic, because you're going to set yourself up for failure. You're going to get frustrated. Frustration leads to stress, that leads to eating, that leads to obesity. So gradually change, eliminate meat, 2 or 3 times a week, because most people in America eat meat every day, or dairy every day. So we have this meatless Monday concept. Well, make it meatless Monday, Wednesday, Friday. So gradually move into a more plant-based diet. Make plant-based your staple, not your, meat and dairy should be a condiment. Every once in a while, you can treat yourself to it. Alcohol has to be controlled too. It's a huge problem, especially with COVID. Alcohol sales went through the roof in the United States. Avoiding tobacco. If you're a smoker, you got to quit smoking. When you inhale that, thousands of chemicals in tobacco in the lung, what a significant source of inflammation you're putting in with every puff. So you got to quit smoking, control your alcohol start exercising a little bit. If you can't walk 30 minutes a day, 5 times a week, do it 3 times a week. So don't set unrealistic goals. And then, in terms of stress, and social support, reach out to friends. It's surprising that how many women tell me that when they go to work and they come out and say, hey, I have breast cancer, people come out of the woodwork. Oh, I had it too, or my sister has it, my mother has it. So I think reaching out for social support is also extremely important.
Amazing 3 points. Thank you so much for this incredible interview. Thank you for taking 1 hour of your time to talk to us about this important topic. If you would like to join the conversation further, do join us on afternoonteawithdocs.com. We will add the links in the comments below. And for those who have joined us now on Zoom, you have the amazing privilege to speak to Ernie here on Zoom right now and ask your burning questions. So for now, thank you and have a good night for those who joined us on YouTube, and we'll go on a less formal conversation here on Zoom. So thank you and
thank you so much.